much healthcare is given in a rather paternalistic fashion, on the assumption that the clinician has all the answers and the patient knows nothing. Person-centred care turns that upside down and says that the patient has a huge amount they can do to benefit their own health, leading to better outcomes and indeed more cost-effective healthcare. The person-centred clinician recognises that patients have a huge role to play in managing their own healthcare and aims to support them in doing that. Patients have to be prepared to be talked to in a different way than they're often used to, but patients are never the problem with this. Patients usually like it. It's clinical teams that struggle. They've been taught for years and years that they are the experts. And this approach recognises that there are at least two sources of expertise. So there's the patient's expertise as well as the clinician's expertise, and you've got to bring those two together. What people want is they want to talk to clinicians who have empathy, who understand them and their needs, who recognise that the patient's goals are just as important as the clinician's goals. Clinicians have to share information about evidence, about what the evidence says about which is the most effective treatment, and also share information about the various alternatives, because there is usually more than one way to treat a health problem. The consultation in that case is rather different in that there's a sharing of information. The information the patient brings is recognised as just as important as the information the clinician brings. Usually there'll be some preparation, and then they'll work together to decide on the best course of action.